There are three groups of muscles in the thigh that can cause pain: the hamstring muscles at the back of the thigh, the quadriceps muscles at the front of the thigh, and the adductor muscles of the inner thigh. The hamstrings and the quadriceps tend to be at a higher risk of painful strains because they cross the hip and knee joints, are used in straightening and bending the legs, and can be injured in running, jumping, and various sports. If you have thigh pain, there are ways you can try to alleviate the pain. Alleviating pain with the rice method. Number 1. Try the rice method. When you feel thigh pain, you can immediately use the rice method. The rice method is a first aid treatment that can help reduce inflammation and pain and help with healing. It's used with muscle strains, sprains, bruises, and other injuries. You use the rice method for the first 2 days after an injury. It includes rest, ice, compression, elevation. Number 2. Rest and protect your leg. The first thing you should do if you think you have a pulled thigh muscle is to stop whatever activity you are doing. Continuing to work out or use a pulled thigh muscle can cause more damage. You should rest your leg from any physical activity that requires the use of your thighs. You should rest the muscle for at least 1 or 2 days. Take the weight off your leg as soon as possible. Sit down or lie down in a comfortable position as possible. Number 3. Ice the injury. The next step is to apply an ice pack to your injured thigh. Applying cold to an injury helps reduce blood flow, which can help alleviate pain. This also reduces acute swelling and inflammation. Number 4. Use compression. Wrap the injured area with a compression bandage or use compression shorts. The compression bandage or shorts help to reduce swelling by limiting the swelling to that area. The compression also provides support to the injured area. Number 5. Elevate your leg. Elevate your leg by keeping it raised above the level of your heart for as much time as you can. This helps to reduce swelling. If you can't raise the leg above the heart, keep it parallel to the ground. After the first or second day, you should move a little bit every hour or so. Take it easy and take it slowly. Don't overdo it. You can make it worse by re-injuring the thigh muscles. Reducing pain in other ways. Number 1. Avoid harm factors. During recovery from all strains, avoid the harm factors during the first 24 to 72 hours after injury. Number 2. Use pain relievers. You can use non-prescription, over-the-counter medication for the first few days for the pain in your thigh. These medicines can also reduce the inflammation. Number 3. Use heat. Heat can help a sore, tight muscle by helping the muscle relax. It also helps circulation into the muscle. Don't use heat on a fresh injury or acute pain. Wait for at least 48 to 72 hours before applying heat. Number 4. Alternate hot and cold. After you can walk on your thigh without pain, you can apply alternating heat and cold. This can help reduce pain and swelling. Number 5. Use a foam roller to stretch and massage. After you can walk without pain, talk to your personal trainer or a physical therapist about using a foam roller to stretch and massage the injured thigh muscles. Number 6. Soak in an Epsom salt bath. Epsom salt is believed to be anti-inflammatory properties that help lessen pain in sore muscles. Soaking in a hot Epsom bath gives you both the benefit of the Epsom salt plus the heat from the water. Number 7. Try a thigh massage. After the acute pain has passed and the thigh has started recovering, try massaging your leg. Applying light pressure can help alleviate the pain. Number 8. Perform stretching exercises. Stretching can help limit the damage and limit the risk of re-injury. Stretching exercises are especially helpful if you injure your hamstring or have pain in your inner thighs. Generally, your doctor or physical therapist will help you decide if stretching is the correct method of treatment for you. Number 9. Visit your doctor. See your physician as soon as you can. If, immediately after the injury, you cannot put any weight on the injured leg or you can't walk more than 4 steps without significant pain. Thanks for watching this video.